Well, COVID-19 has brought health to the forefront of millions of Americans' minds, especially for women who actually rank it as their top health concern. That's according to a new national survey from MDVIP.
Yet the same survey shows that most women are not getting the information they need to address the greatest health risks they face, with 9 in 10 women failing a women's health IQ quiz. Joining us now to explain a little bit more about what this means, Dr. Andrea Klemes, Chief Medical Officer of MDVIP. Nice to see you. Nice to talk to you.
Thank you for having me.
Okay, so stunning. 94% of women failed this quiz, didn't do as well in it as we would hope. What kinds of things are they failing on?
Well, I think the most surprising misconception was that women are very concerned about cancer and arthritis, more so than heart disease. Yet heart disease is the #1 killer, and it's deadlier than all other cancers combined. Interestingly, they were concerned about cancer, but they got most of the cancer questions wrong. 8 out of 10 did not know that a pap smear only screens for one cancer, not all female cancers, or that lung cancer is the deadliest for women, or even knowing the risk factors for breast cancer.
And do we think that's because they're not understanding the information, or the information's not being communicated to them? They're not getting kind of enough face time with medical professionals?
It's probably a little bit of both. Part of it is in the medical field, we don't know enough about how specific diseases affect women. I had a patient who had some serious stomach problems, went to a doctor, was told, don't worry, go home, it's just stress, take an antacid. She ended up in the emergency room that night and she was having a heart attack. So women don't typically get that elephant sitting on their chest like men do. So we need to educate them more about how diseases really affect them.
That's so interesting. When it comes, though, to their emotional well-being, how they're doing mentally, how did they score when it came to those questions?
Well, the pandemic has taken a toll on everybody. Over 50% said that they were more anxious, depressed, stressed out. Even 41% said they felt like they were going to have a breakdown. And interestingly, over 60% of women have never been screened for things like depression or anxiety.
Here in Illinois, COVID restrictions are starting to loosen up, and we're actually given a date in June when we may not have any restrictions anymore. Should people view that as like, oh, okay, I should be emotionally healthier now because we can actually see an end in sight? And perhaps is it some type of warning sign if you're not encouraged by that news?
I don't think it's just a green light. We have gone through a lot over the last year. And women especially have had a lot on their plate with trying to take care of kids doing virtual school and working and, taking care of the whole family. There is also concern what is going to happen for the future. Hopefully everybody's vaccinated and we can go back to living a normal life, and COVID will kind of be like the flu in the future, right? Maybe we'll just have to get a shot a year and we won't worry as much about it as long as we're healthy. But still, if you're not feeling good, you need to be able to reach out and ask for help. That's one thing that many of the people in the survey weren't very good at.
Yeah, and I think, with Mother's Day coming up, I think it's an important topic to discuss because a lot of moms sort of put themselves last and they need to be putting themselves first, right? Okay, where can they take this quiz?
You can go to mdvip.com/women's health IQ. You can take the quiz. You can learn more about MDVIP and find a doctor in your area that can help take care of you and spend a little bit more time with you.
Okay, Dr. Klemes, we appreciate your time. Thank you.
Thank you.
Thank you for having me.
All right, let's